Hello, my friend. Welcome to your surgery story. My name is Dr. Mike, and it's my privilege to be with you tonight as you drift off to sleep. I'm a surgeon, and for the past 15 years, I've worked in emergency medicine and trauma surgery. Some cases stay with you longer than others. They change the way you see the world, the way you understand the choices people make. Tonight, I want to share one of those cases with you. A young man, barely 25, who walked into my operating room on a Thursday evening. Before you drift off, do me a favor and hit that subscribe button. These stories matter, and you won't want to miss what comes next. Now let me take you back to that evening. The call came through around 7 p.m. I was finishing rounds, checking on post-operative patients, making sure everyone was stable for the night. My pager buzzed, and I glanced at the number. Emergency department. I called back immediately, and the voice on the other end was one I knew well. Dr. Sarah Chen, an emergency physician I'd worked with for years. She sounded concerned, which was unusual. Sarah had seen everything, dealt with everything. Not much rattled her anymore. She told me she had a patient, male, 25 years old, presenting with severe pain, swelling, and redness in both arms and legs. Fever, elevated white blood cell count, signs of systemic infection. But here was the unusual part. The patient had admitted to injecting industrial silicone into his muscles over the past 6 months. DIY body enhancement, trying to achieve a more muscular appearance. Now his body was rejecting it catastrophically. She needed surgical intervention, and she needed it soon. I felt my stomach tighten. I'd heard of these cases, read about them in medical journals, seen the warnings circulated through surgical conferences. Silicone injections, usually obtained online or through unlicensed practitioners, being used for cosmetic enhancement, buttocks, breasts, facial features, and yes, muscles. The silicone wasn't medical grade. It was the kind used in automotive applications, construction, industrial sealants, never meant to go inside a human body, and when it did, the results were often devastating. I told Sarah I'd be down in 5 minutes. I grabbed my tablet, pulled up the patient's chart as I walked. His name was Tyler Bennett, 25 years old, no significant medical history until tonight. Height 5'10", listed weight 170 pounds, though Sarah noted that seemed inaccurate given his appearance. No chronic conditions, no regular medications. But the lab values told a different story. White blood cell count elevated to 18,000. Normal is under 11. C-reactive protein, a marker of inflammation, was sky high. Blood pressure slightly low. Heart rate elevated at 115. The emergency department was busy that evening, the usual Thursday night crowd. I navigated through the hallways, past curtained bays where other dramas were unfolding. Sarah met me outside room 12, and her expression confirmed what I'd heard in her voice. This was serious. She handed me a pair of gloves, and we stepped inside together. What I saw stopped me for a moment, not from shock, but from the profound sadness of it. Tyler lay on the gurney, his upper body elevated at about 30 degrees. His arms were massively swollen, each bicep and forearm grotesquely enlarged, the skin stretched tight and shiny. His legs, visible below the hospital gown, showed similar swelling in the thighs and calves, but it wasn't the muscular definition of a bodybuilder. It was the irregular, lumpy swelling of fluid and foreign material. The skin over his right bicep was deeply reddened, almost purple in places, with areas that looked like they might rupture. His left thigh showed similar changes. He was awake, eyes moving between Sarah and me, filled with fear and pain. Sweat beaded on his forehead despite the cool temperature of the room. His breathing was rapid, shallow, the kind that comes when every movement hurts. I introduced myself, keeping my voice calm and neutral. "Tyler, I'm Dr. Mike. I'm a surgeon and I'm here to help. Can you tell me what's going on?" He nodded, wincing, and began to speak. His story came out in fragments, interrupted by pain. He'd been thin most of his life, he said. Skinny, people called him. He'd tried working out, lifting weights, eating more protein, but he never gained the muscle mass he wanted. He'd see guys at the gym, guys online, with these huge arms and legs, and he felt inadequate, small, invisible. Then he'd found forums, online communities where people talked about shortcuts. Synthol, they called it, or site enhancement oils. Substances you could inject directly into muscles to make them bigger instantly. Tyler had started researching, reading testimonials, watching videos. People claimed it was safe, that bodybuilders used it all the time. that it was just a temporary boost until real muscle could develop. He found a supplier online, someone selling silicone oil in unmarked bottles. It was cheaper than he expected. He ordered several bottles, received them in plain packaging. The instructions were minimal. Just inject into the muscle belly, they said. Start small, build up gradually. Easy. He'd started 6 months ago, he told me. Small amounts at first, 0.5 milliliter here and there in his biceps. It worked. His arms looked bigger almost immediately. He felt confident for the first time in years. So he continued. More injections, larger volumes, spreading to his triceps, his forearms, his thighs, his calves. At his peak, he was injecting 5 to 10 milliliters per session, multiple times a week. His arms grew to 18 inches around, his legs thickened. People noticed. They complimented him, asked what his workout routine was. But about 2 weeks ago, he started noticing problems. His right arm felt warm, tender to the touch. He dismissed it as muscle soreness. Then the swelling increased, and the redness appeared. His left thigh started showing similar symptoms. He tried ignoring it, hoping it would resolve, but yesterday he'd spiked a fever. This morning, the pain had become unbearable. He couldn't bend his arms or legs without agony. That's when he'd finally come to the hospital, terrified but out of options. I examined him carefully, palpating the swollen areas as gently as possible. The tissue felt wrong. Not firm like muscle, not soft like fat, but somewhere in between. Boggy, we call it in medicine, like a water balloon filled with something thicker than water. In several places, I could feel fluctuance, a sign of fluid collection underneath. His skin was hot to the touch, the heat of infection radiating outward. When I pressed gently on his right bicep, he cried out, and I saw a small amount of fluid seep from what looked like a tiny puncture wound, probably from one of his injection sites. Sarah had already started broad-spectrum antibiotics through his IV, covering the most common bacteria. But looking at Tyler, at the extent of the problem, I knew antibiotics alone wouldn't be enough. The silicone was acting as a foreign body, a persistent source of inflammation and infection. His immune system was attacking it, trying to wall it off, but it couldn't break it down or eliminate it. The only solution was surgical debridement. We needed to open the affected areas, remove as much of the silicone and infected tissue as possible, and drain the infection. I explained this to Tyler as clearly as I could. Surgery, I told him, was necessary. We'd make incisions in his arms and legs, go into the muscle compartments, remove the silicone and any dead or dying tissue. It would be extensive. There would be scarring. His arms and legs would be smaller afterward, much smaller, probably smaller than they'd been before he started injecting. And there were risks: nerve damage, blood vessel injury, continued infection, the possibility of needing multiple surgeries. In the worst case, if infection had spread too deeply or if blood flow was compromised, we might be looking at amputation. Though I hoped it wouldn't come to that. Tyler's eyes filled with tears. He nodded, understanding. He asked only one question. Will I survive this? I paused, choosing my words carefully. I told him we'd do everything we could, that the team was excellent, that we'd caught it before it progressed to sepsis or organ failure. But I couldn't make promises. Surgery always carries risk, and this was complicated. He needed to know that. He signed the consent forms with a shaking hand, and I left to prepare. The operating room was notified. We'd need a large setup, multiple instrument trays, good suction, plenty of irrigation fluid. I called in Dr. Marcus Webb, a plastic surgeon who specialized in complex wound management. If we were going to debride this extensively, we'd need his expertise for closure and reconstruction. He arrived within 20 minutes, already scrubbed and ready. We reviewed Tyler's imaging together. The CT scan Sarah had ordered showed something I'd hoped I wouldn't see. The silicone wasn't just in the muscle, it had migrated, tracking along tissue planes, spreading into deeper compartments. In Tyler's right arm, the silicone had infiltrated between muscle groups, surrounding the neurovascular bundle that contained the major artery, vein, and nerves. In his left thigh, a similar pattern. The silicone was everywhere, and some areas showed gas bubbles, a sign of necrotizing infection. Bacteria that produce gas as they consume tissue. This was worse than I'd initially thought. We'd need to be aggressive, but also careful. One wrong move, and we could sever a major blood vessel or nerve. We brought Tyler to the OR around 9 p.m. The anesthesia team, led by Dr. Nina Rodriguez, worked quickly to get him under. His blood pressure had dropped further, sitting at 90/50. His heart rate remained elevated. Nina started vasopressors, medications to support his blood pressure, and continued the IV antibiotics. Tyler drifted off, the anesthetic taking hold, and suddenly the room shifted into that focused intensity that defines surgical work. I stood on Tyler's right side, Marcus on the left. Two scrub nurses, Jennifer and Paul, had our instruments ready. The overhead lights were positioned perfectly, casting no shadows. I took a breath, picked up the scalpel, and made the first incision on Tyler's right arm. The blade cut through skin, and immediately I saw what we were dealing with. Beneath the skin was not normal yellow subcutaneous fat, but a gray-white substance mixed with blood and pus. The silicone. It oozed out as I deepened the incision, thick and viscous, mixed with inflammatory fluid. The smell hit me then, the characteristic odor of infection, slightly sweet and rotten. I extended the incision, running it from his shoulder down to his elbow, following the line of his bicep. Marcus made a similar incision on the left arm. We needed access, needed to see the full extent of the damage. As I spread the incision open with retractors, the anatomy became clearer, or rather, how distorted it had become. The muscle tissue, which should have been deep red and well-defined, was infiltrated with silicone. It looked marbled, streaks of gray running through the red. In some areas, the muscle had turned dark brown, almost black. Necrotic. Dead tissue that would have to be removed. I started debriding, using scissors and a scalpel to cut away the dead muscle. Each piece I removed was placed in a specimen container. We'd send it all to pathology, though I already knew what they'd find. The silicone was everywhere. It coated the muscle fibers, pooled in pockets between tissue layers, surrounded the blood vessels like a sheath. I used suction to remove the liquid portions, watching as the canister filled with gray fluid. But the more solid silicone, the parts that had formed granulomas or been encapsulated by scar tissue, had to be physically dissected out. It was painstaking work, millimeter by millimeter, trying to remove foreign material while preserving anything that still looked viable. Marcus was encountering the same problem on the left arm. He called out findings as he worked: extensive silicone infiltration, necrotic fascia, purulent fluid collections. We were an hour into the surgery, and we'd barely made progress. Tyler's right arm was open from shoulder to elbow now, a wide canyon of exposed tissue. I could see the brachial artery running down the center, pulsing weakly. The median nerve beside it looked inflamed but intact. These were structures we absolutely had to preserve. I continued debriding, removing more dead muscle, more silicone. Tyler's bicep, which had measured 18 inches around, was being reduced to almost nothing. I was taking out handfuls of tissue, leaving behind only the vital structures and whatever muscle still showed signs of life. It was like excavating, carefully removing layers to find what could be saved underneath. And with each layer, I found more silicone, more infection, more damage. Nina called out from the head of the table. Blood pressure dropping, 85/45. I glanced at the monitors. Tyler's heart rate had climbed to 130. His oxygen saturation was holding at 94%, but his body was struggling. The surgery itself was a stress, but more than that, we were releasing inflammatory mediators into his bloodstream with every bit of infected tissue we disturbed. His immune system was in overdrive, and his cardiovascular system was paying the price. Nina increased the vasopressor dose, added a second medication to support blood pressure. We pushed IV fluids, trying to maintain his circulating volume, but Tyler's body was fighting us. Every 15 minutes, Nina would call out new numbers. Blood pressure 70/40, heart rate 140, then blood pressure 60/30, heart rate 150. We were losing him, slowly, inexorably. His body couldn't handle the insult of the infection combined with the trauma of the surgery. I made the decision to move faster. We couldn't be as meticulous as I wanted. We needed to remove the bulk of the infected material and get him closed. Marcus and I worked in synchronized rhythm, debriding aggressively now, sacrificing some precision for speed. We moved to Tyler's legs, making long incisions down his thighs and calves. The same nightmare greeted us. Silicone infiltrating the muscle compartments, necrotic tissue, pus-filled pockets. His quadriceps muscles were devastated, entire sections that had to be removed. We were 3 hours into the surgery. Tyler's arms and legs were open, the muscle groups exposed and partially excavated. We'd filled multiple suction canisters with fluid and debris. The specimen containers held pounds of tissue. But Tyler was deteriorating. Nina's voice grew more urgent. Blood pressure 50/20. Heart rate 170. He's becoming acidotic. pH is dropping. His lactate is rising. These were signs of shock, of organs not getting enough oxygen, of the body beginning to fail. We started blood transfusions. Tyler was bleeding from the surgical sites, not profusely, but steadily. The inflammation had made his tissues friable, easy to tear. Every time we pulled on something, it would bleed. We cauterized vessels, tied off bleeders, packed areas with hemostatic gauze, but it felt like trying to bail out a sinking boat with a teaspoon. For every problem we solved, 2 more appeared. Marcus looked at me across the table. His eyes above his mask were troubled. I knew what he was thinking because I was thinking the same thing. We might not be able to save Tyler. Despite everything we were doing, despite the antibiotics and the surgery and the blood products, his body was giving up. The infection was too severe, too widespread. The silicone had caused too much damage, and the surgery, necessary as it was, had pushed him over the edge. I made the decision to abbreviate. We couldn't complete the debridement. We'd remove what we could access easily, irrigate everything thoroughly with liters of saline mixed with antibiotics, and close. Tyler needed to get to the ICU, needed higher levels of support than we could provide in the OR. We worked quickly, flushing out the wounds, placing drains in each surgical site to allow continued drainage of fluid and infection. Marcus began closing, starting with the deep layers, bringing muscle and fascia together where possible. We'd removed so much that gaps remained, areas where muscle simply didn't meet anymore. Marcus used absorbable sutures, working efficiently, and then closed the skin layer. The incisions were long, running the length of Tyler's limbs, closed with staples for speed. It wasn't pretty. This wasn't cosmetic surgery. This was damage control. We finished around 1 a.m., 6 hours after we'd started. Tyler lay on the table, his limbs wrapped in bulky dressings, drains protruding from multiple sites. His blood pressure was being maintained on maximum doses of 3 different vasopressors. His heart rate was 180. Nina had placed him on a ventilator an hour earlier when his breathing had become inadequate. He was alive, technically, but barely. We transferred him to the ICU, and I walked alongside the gurney, watching the monitors, watching the numbers that told me what I already knew. Tyler was dying. The ICU was bright and cold, the nurses moving with practiced efficiency. We transferred Tyler to the ICU bed, connected him to their monitors, their ventilator, their medication pumps. I gave report to the intensivist, Dr. James Patterson, running through everything we'd done, everything we'd found. James listened, his face grave, and told me he'd do everything possible. But we both knew the odds. Tyler's lactate was critically high. His kidneys were beginning to fail, urine output dropping. His liver enzymes were rising. Multi-organ dysfunction, the cascade that begins when the body can no longer compensate. I stayed in the ICU for another hour, watching Tyler's monitors, adjusting medications, supporting James and the nursing staff. Tyler's parents arrived around 2 a.m., having driven through the night after getting the call. They looked destroyed, aged by fear. I met them in the family consultation room, a small space with uncomfortable chairs and a box of tissues on the table. I told them what had happened, what we'd done, and what the situation was now. Their son was critically ill. We were doing everything medically possible, but his body was in shock, and his organs were failing. His mother cried, deep racking sobs. His father sat stone-faced, unable to process. They asked why, how could this happen? And I explained as gently as I could. The silicone, the infection, the body's inflammatory response. It was a perfect storm of factors. Tyler had made a choice, not understanding the consequences, and now he was paying the price. They asked if they could see him. I walked them to his room, warned them about the machines, the tubes, the appearance, but nothing prepares a parent for seeing their child like that. Tyler lay motionless, his face swollen, his skin pale with an undertone of gray. The ventilator breathed for him, his chest rising and falling mechanically. His arms and legs were unrecognizable, wrapped in dressings, reduced to half their previous size. His mother stood beside the bed, touching his hand carefully, whispering to him. His father stood at the foot, staring, uncomprehending. I gave them privacy, stepping back into the hallway, leaning against the wall, feeling the exhaustion settle into my bones. Over the next 6 hours, Tyler's condition continued to decline. Despite maximum support, his blood pressure kept dropping. His kidneys stopped producing urine. His liver failed, causing his bilirubin to rise, his skin taking on a yellow tinge. His blood stopped clotting properly, and he began bleeding from his IV sites, his surgical wounds, his gums disseminated intravascular coagulation, a complication where the clotting system goes haywire. We transfused more blood, gave clotting factors, but nothing worked. His body had reached a point where medicine couldn't help anymore. At 8:30 a.m., Tyler's heart rhythm changed. The monitor showed ventricular tachycardia, a fast, chaotic rhythm that couldn't pump blood effectively. James called for the crash cart, started CPR, pushed medications. We shocked Tyler's heart, once, twice, 3 times. The rhythm would convert briefly to something more normal, then deteriorate again. We ran the code for 40 minutes, cycling through every protocol, every drug, every intervention. But finally, the rhythm flatlined, asystole, no electrical activity at all. James looked around the room, at the ICU team, at me. He called time of death. 9:12 a.m., Tyler Bennett, 25 years old, was gone. The room fell silent except for the hiss of the ventilator, which we turned off. I went to find Tyler's parents. They were still in the consultation room, and I think they knew before I said anything. I sat down across from them and told them Tyler had passed away. We'd done everything we could, but the infection and organ failure were too severe. I'm so sorry. His mother collapsed into her husband's arms. His father just nodded, still in shock. I sat with them for a while, answering questions when they could form them, mostly just being present. There's nothing you can say in these moments that makes it better. No platitude that eases the pain. You just stay, bear witness to their grief, and offer what little comfort your presence provides. Later I sat in the physician's lounge, writing my operative notes, my ICU notes, all the documentation that comes with a death in the hospital. My hands moved automatically, typing words I'd typed too many times before. But my mind was elsewhere, thinking about Tyler, about the choices that had led him to my operating room. He'd wanted to look strong, to feel confident, to be seen. And in pursuing that, he'd destroyed himself. The silicone he'd injected, bought online for a few $100s, had cost him everything. It wasn't approved for human use, wasn't sterile, wasn't safe. But he hadn't known that, or hadn't believed it, or had thought he'd be the exception. The forums he'd read, the videos he'd watched, they'd made it seem easy, harmless even. They hadn't shown the Tyler Bennetts of the world, the ones who ended up in operating rooms and ICUs, fighting for their lives. I thought about body image, about the pressure young men face to look a certain way. Muscular, strong, powerful. The Instagram photos, the fitness influencers, the unrealistic standards. Tyler wasn't alone in feeling inadequate. There are thousands like him, maybe millions, who look in the mirror and hate what they see. Most find healthier ways to cope, but some, desperate and vulnerable, turn to dangerous shortcuts. And sometimes those shortcuts are fatal. The hospital continued around me, other surgeries scheduled, other patients arriving, the perpetual motion of healthcare. But I sat still for a long time holding my coffee, thinking about a young man who just wanted to feel good about himself, who'd made a terrible decision based on incomplete information and false promises, who'd paid for that decision with his life. These are the cases that stay with you, not because they're medically fascinating, but because they're human, because they represent real people with real hopes and real families who loved them. Tyler's death was reported to the medical examiner, as all unexpected deaths are. An investigation would follow, trying to determine exactly what he'd injected, where he'd gotten it, whether there were others at risk. Public health officials would be notified. Maybe it would lead to warnings, to crackdowns on illegal suppliers, to education campaigns. Or maybe it wouldn't. Maybe Tyler would be another statistic, another cautionary tale that most people never hear. I finished my notes and went home as the sun climbed higher. I was exhausted, physically and emotionally, but before I slept, I thought about what I'd say if I could talk to young people considering what Tyler did. I'd tell them that there are no shortcuts to health, no quick fixes to self-esteem. that your body, whatever shape it's in, is the only one you get, and it deserves respect and care, not industrial chemicals injected into it. That the people who truly matter don't care about the size of your muscles, they care about who you are. I'd tell them that the pursuit of perfection is a trap, that perfection doesn't exist, that every body in every advertisement and social media post is edited, filtered, posed, and lit to look superhuman. But we're not superhuman. We're just human. Flawed, vulnerable, imperfect. And that's okay. That's more than okay. That's beautiful in its own way. But most of all, I'd tell them Tyler's story. Not to scare them, though it is scary, but to make it real. To put a face and a name to the statistics. To show what can happen when desperation meets misinformation. Tyler was someone's son, someone's friend. He had dreams, plans, a future that should have stretched out for decades. And all of it ended on an operating table because he wanted to look different. So if you've stayed with me through this entire case, if you've listened to Tyler's story from beginning to end, I'm grateful. These stories need to be told, they need to be heard. Because maybe, just maybe, hearing them will save someone else from making the same choice. Before you drift off, leave a comment. Tell me you heard Tyler's story. Share it if you think it might help someone. Because that's all we can do now. Learn from the tragedy, try to prevent the next one, and remember the lives that were lost along the way. Until the next case, rest well and take care of yourself. See you in the next surgery.